The Indian Council of Medical Research (ICMR) issued a big statement regarding plasma therapy, which is touted as a life-saving intervention for patients suffering from severe COVID-19. The Director General of ICMR, Balram Bhargava, stated that plasma therapy may be deleted from the national clinical protocols for the management of COVID-19. We have had a discussion with the National Task Force for COVID-19 Management. We are discussing further with the Joint Monitoring Committee and contemplating on removing the plasma therapy from the national guidelines, he said. The statement has come in the wake of several studies conducted on the efficacy of convalescent plasma therapy, which suggested that it did not reduce mortality or progression to severe disease condition. ICMR's own study, which came out in September, revealed that plasma therapy failed to save people from COVID-19. Normal healthcare services in Jawaharlal Nehru Institute of Medical Sciences Hospital in Imphal, one of the two biggest government-run hospitals in Manipur, was severely affected after more doctors and nurses got infected by COVID-19. A hospital source said that as many as 170 doctors, nurses, and paramedical staff contracted the disease so far while discharging their healthcare duties in the hospital. Even though some have recovered and joined normal duties, most are currently under medical treatment, the source said. This, coupled with the increasing number of COVID-19 patients getting admitted in the hospital, has greatly affected the normal healthcare services in the hospital, the source added. Jawaharlal Nehru Institute of Medical Sciences and Regional Institute of Medical Sciences hospitals are the biggest government-run hospitals rendering healthcare services in the state and taking an active role in treating COVID-19 infected patients. Earlier, Regional Institute of Medical Sciences had also suffered the similar situation when many of its doctors, nurses, and paramedical staff contracted the virus. Government of India's representative and interlocutor for Naga peace talks R.N. Ravi and Working Committee of NNPGs are scheduled to hold an official meeting on October 22nd at Police Complex Chumukedima in Dimapur. Sources inform that NNPG's delegates will be led by convener N. Kitovi Zimomi. Ravi, who is also the governor of Nagaland, will chair the meeting wherein both parties are expected to discuss details to sign the much-awaited final agreement. Naga People's Front (NPF) celebrated its 58th Foundation Day at NPF Central Headquarters in Kohima today. Delivering a speech, NPF President Dr. Shirhozele Lizitsa said that the NPF party, popularly known as the Cock Party in the rural areas, was formed on 21st October 1963, and within 39 days the party got registered with the Election Commission of India. Dr. Lizitsa said that NPF party was formed not by choice but out of necessity for the interest of the Naga people and their future. Chairing the program, NPF Secretary General Achumbemo Kikon said that it is for the first time NPF is observing its Foundation Day. He said that NPF is the oldest regional party in the Northeast and second oldest party in the country. The Secretary General also said NPF have produced 7 chief ministers, MLAs, and party leaders over the years. The Meghalaya Human Rights Commission (MHRC) has sent notices to the State Health and Family Welfare Department and Social Welfare Department to explain through a report the cause of death of 877 newborns and 61 pregnant women during the COVID-19 pandemic. The notices were issued based on a petition filed by social activist Agnes Karsheng, who had sought intervention of the Meghalaya Human Rights Commission with regard to the large number of deaths of pregnant women and newborns in the state during the month of April till July 2020 due to diseases other than coronavirus. The death of most of the pregnant women was because they were not admitted to a hospital on time. In her petition, Karsheng pointed out that the state has 12 big hospitals, including private ones. Moreover, there are 30 community centers, 110 primary healthcare centers, and also civil hospitals in each of the 11 districts in the state. Republic TV said it will sue Mumbai Police Commissioner Parambir Singh for Rs 200 crore for allegedly damaging its reputation by linking it to the television rating points scam. The channel added that it will file a contempt petition against Special Executive Magistrate and the Assistant Police Commissioner Sudhir Jamwadekar on account of the fact that he initiated chapter proceedings with respect to the FIRs that have been suspended by the Bombay High Court, it said in a statement. Meanwhile, Republic TV's announcement came hours after the Bombay High Court said if the Mumbai Police Crime Branch proposes to arraign Republic TV editor-in-charge Arnab Goswami in the television rating points case, it should first issue summons to him, as was done for 8 others in the case. Indian judo team will be participating in the Budapest Grand Slam, which contributes to the Olympic qualification between October 23rd and October 25th. This will be the first tournament that the Indian judokas will be playing since the nationwide lockdown was imposed due to the COVID-19 pandemic. Ahead of the departure for Hungary, Union Sports Minister Kiren Rijiju met the contingent, which comprises 5 judokas. The Sports Minister wished the contingent luck for the tournament and said preparations are in place to ensure that a strong talent pool emerges for the 2024 and 2028 Olympics. With positive cases rising all across the nation, the COVID-19 status of northeastern states are: like, subscribe, and hit the bell icon for news that matters and stories that inspire.